Welcome, everyone. I'm Jack, one of the joint organizer for medicines to support this event. Most importantly, I want to introduce Johanna, our major host and also facilitator today. So Johanna, I pass to you. Thank you.
Yeah, thank you so much. We're super excited to be hosting this event today. And we are seeing a really good turnout, which tells me that actually we're dealing with a demographic, or this topic we're talking about today is actually very much underserved. So we want to create some awareness around the topic of C-section scars. And we have various speakers today for you that I will be introducing in a short while. So my name is Johanna Wagner. Many of you know me. I'm the host for today's webinar. I've been working as a birth doula and postpartum doula, childbirth educator in Singapore for more than 10 years and supported more than 400 births. And today is all about Caesarean birth and different modalities that we have available to support recovery. And we'll be hearing from different experts in their field. And we'll dive right in and start with the major topic of our webinar, which is the nature of C-section scars, how healing occurs, and also what treatment options we have available. So we've got Associate Professor Tey Hong Liang, is a clinician, a scientist, an innovator, an entrepreneur who has created significant impact through his work in research, innovation, and enterprise in dermatology. He's among the world's top 2% cited researchers and is currently the director at the Center for Medtech Innovations, National Healthcare Group. Sorry, I'm stumbling over my words. Concurrently, he's the co-director of the Skin Research Program at Lee Kong Chian Medicine, Nanyang Technological University, a Senior Clinician-Scientist with the National Medical Research Council, and a Senior Consultant at the National Skin Center in Singapore. Wow, quite a list of accreditations, Dr. Tey. So thank you for joining us today and spending your lunchtime with us. Thank you for sharing your screen. We're waiting for it to load, and we're very excited to hear you speak for us today.
Thank you very much, Joanna. Yeah, good afternoon, everyone. I'm Hong Liang. I'm from the National Healthcare Group and also the LKC Medicines and also National Skin Center Singapore. So today I'm going to talk about this topic that patients come to us asking for solutions, but it is something that we don't really have a lot of sort of attention to, pay a lot of attention to, and this is an area of unmet need, and we are always trying to find solutions to patients' problems, where are the gaps in clinical practice, and we try to fill them to actually really address the patient's problems. So usually the Caesarean scars, you hope you get a normal flat line, thin scar that gradually fades over months to years. And this is what we usually just assume it happens. But however, in about 18% of cases, you get a thick raised scar confined to the original incision site. Okay, this is not too bad, but in about 4 to 18% of patients, you get an overgrown scar extending beyond the incision. A lot of times we don't mind if a problem arises, we know how to treat it, we have solutions for it for them. But the problem with these scars is that they don't have very good solutions, and therefore we need to prevent such scars from appearing. And many patients actually know that these are potential problem, especially if they have bad scars elsewhere, and they come to us asking for solutions to prevent this. And unfortunately, traditionally, we don't really have very much of a solution. So today, I hope I can shed some light on how can we prevent bad scars from forming, because bad scar is not just a cosmetic appearance issue, but also a symptomatic issue. Let's talk a bit about the science behind scar formation. We understand a bit how scar forms, and we know how to intervene better. So there are various phases to wound healing. Firstly, you get cut, you have bleeding, you have inflammations in the beginning. This inflammation phase lasts about just 2 days, where your body actually stops the bleeding with the platelets, and your cells starts coming in to try to heal that wound as soon as possible. And this these cells are called fibroblasts. So they migrate over to the wound site and they proliferate and produce collagen. And the main aim of these cells is actually, oh, I want to close up this wound. I will produce a lot of collagen, a lot of red blood vessels to try to close up this wound. Thereafter, the proliferation phase, you get this maturation phase, which is from a week afterwards, where the collagen remodeling happens, where you form a stronger type of collagen to close up the wound. And thereafter, after the maturation phase, you go into this remodeling phase where the wound actually breaks down, reform, break down, reform. The cycles continue until you get a mature scar formation. However, this is sometimes things can go wrong. When you have too much of collagen formation, because the body is trying too hard to close up the wound, this is producing so much just for the sake of closing the wound. But the problem is that when you have too much of a collagen, you get a very bumped up scar. And not only that physical appearance is an issue, but because there's so much collagen formation, it can actually press on your nerves and you start feeling itchy, you start feeling painful even. So now let's look at various factors. What can we do practically to actually prevent bad outcome? So there are various factors like on the left side, genetics, skin type, darker skin individuals who have a worse form of higher risk of bad scar formation, keloid formation, and that's associated with genetics. And the next one is surgical technique. And again, that one we can't do very much, depends on the surgeon, the intraoperative conditions. You sometimes, you know, you want to have the best outcome for the baby. That's the first thing for the mom. And so sometimes this surgical techniques, the type of incision that you make, you can't control for that. But I think what everyone here, over here, we can talk about what happens after the surgery. How can we take care of the wound better? How can we optimize the healing better? So firstly, we have to keep the wound clean. Now, use gently use saline or prescribed antiseptic solution to actually clean the wound, and avoid harsh antiseptics like hydrogen peroxide or alcohol. Because these harsh ingredients can actually cause irritation and adversely affect the wound healing. And clean the incision gently with a mild cleanser and water. Usually you don't have to use soap all the time. Just pat dry, don't rub, because rubbing actually increase the tension and tears the wound a bit. Just pat. And avoid frequently touching the site, letting it dry. Definitely avoid picking on the scabs or avoid scratching. Two reasons why people tend to actually pick and scratch is because one, you can feel that, oh, there's something abnormal over there, and the tendency subconsciously is to try to take out the scab, and also thinking that picking up the scab can actually help with the skin to heal, but unfortunately that doesn't, it worsens the healing. And of course, with the itch, when it's itchy, then people tend to scratch, and sometimes in the sleep, subconsciously, unconsciously, you will actually scratch the wound without knowing it. So what we do advise patients is that well, when it's itchy in the morning time, when you know about it, instead of scratching, I mean, it's quite impractical to tell people, oh, okay, if it's itchy, just don't scratch. I mean, that's not a very helpful, constructive recommendation. So what we do is that you can apply this cream called Subam cream around the wound. You don't have to apply on the wound itself, especially when it's a new wound and the skin hasn't healed totally. You can apply this cream around the wound. Just a declaration, this is also a cream that we actually produce in our clinic based on unmet needs of our patients. When we started off when I started off this itch clinic, there are patients, so many patients who actually have no solution for their itch issues, and this is a cream that we have come up with. Yeah. Now the next thing is sun protection that will help prevent darkening of the healing scars. And so you can cover the scar with dressing or clothing when possible. And after that, when it heals better and when it's exposed, open up, you can actually use a physical sunscreen, SPF 50 or higher. That would be great. And that you can apply the sunscreen after the wound has closed. So what I mean when the wound closes is that there's no more raw skin. The stitches typically has been taken off during that time. So typically we take off the stitches at 2 weeks. We have to watch out for the signs of infection or poor healing. So what are these signs? Firstly, it could be increased redness, swelling, warm, there's pus, or even foul smell. And that will be the late stage. So we don't want to have it until then. If you have persistent pain that worsens instead of improving, invariably you're going to have some pain after the surgery, but if it keeps on worsening instead of improving, I think that's a red flag. We want to treat the infection quickly to reduce the risk of wider, more noticeable scars. The next thing is about gentle massage. Okay, when the wound has healed, typically after full closure, full healing of the surface skin, typically after 3 to 4 weeks, gentle scar massage may help to improve the scar flexibility, reduce the feeling of tightness, to enhance the blood flow to the area. So I'm going to talk more about this massaging process later. What one can do is also to use a fragrance-free moisturizer, like a bland, plain emollient cream, instead of those heavily fragrant and lots of different botanicals. Or one can use a silicone gel also. So all these will help with the hydration of the skin and making the wound, the scar, actually softer. In terms of the massage, right, you can actually gently use circular motions after you apply the moisturizer, and then you can just gently do circular movement across the scar in the surrounding skin for about 5 to 10 minutes once or twice daily. We don't want to have too much pulling on the scar, so you have to do this gently. The idea is to help with the circulation, increase the blood flow, reduce the tightness of the scar. So the next thing is general nutrition. Overall health, a good wound healing also relies on adequate nutrition, especially proteins, zinc, and vitamin C. That will help with the wound healing process. And smoking is a no-no. Stopping or at least reducing will help with the healing. It is important that we try to minimize the mechanical stress given to the wound, subjected to the wound. So mechanical stress tension is the one single most important factor that actually cause the wound to actually heal in a very exuberant way, producing too much collagen. So what we can do is to avoid bending, heavy lifting, or sudden twisting, the actions that can pull on the scar. And one can consider wearing high waist, soft abdominal support bands, or postpartum compression garments to reduce tension across the scar. So typically, the surgeon will try to do measures when they close up the wound to reduce the scar tension, but certainly it would help after the surgery that we can actually prevent all these pulling motions and tension subjected to the wound. So in somebody who has a personal or family history of keloids or hypertrophic scar, do let the doctor know, because the doctor will watch out for development of such bad scars. So keloids and hypertrophic scars, they are just exuberant production of collagen. Sometimes when it occurs early, the doctor will want to treat it early, because prevention and early treatment is actually the best way. Subsequently, once it's formed, it is going to be an uphill battle trying to get rid of the scars. So let's talk a bit about the scientific studies and evidence that there is in the literature. So silicone, you have probably heard much about it for scar prevention, and a meta-analysis in 2020. A meta-analysis means a grouping of many different studies. You put the different studies together, compare them as much as possible, and try to derive to say that in the literature, does this intervention really work? So this meta-analysis showed that silicone sheet reduces hypertrophic scarring by 42%. So that's good. And also a 2018 study found that early intervention, scars treated with 6 weeks at 6 weeks post-surgery had better cosmetic outcomes than delayed cases. So early intervention actually helps. We apply this early enough and it can help. After once it's formed, it's a bit more difficult to reduce the scar. With regard to the role of massage, there's also a trial that has been performed that demonstrated that gentle scar massage combined with silicone can improve the pliability scores by 38%. And also a meta-analysis showed that the silicone sheet combined with gentle massage reduces hypertrophic scar formation by 40 to 60%. And so we can see that, yes, there are measures that we can try to reduce scar formation using silicone, using gentle massage. And these are the typical measures that's been advised for decades. However, in real clinical practice, we also often find that many cases do not work. And so we don't routinely advise patients to always use a silicone sheet, especially when these are very expensive. We definitely, for patients at risk, then we advise them to do so. And in patients who are concerned, we ask them to do so. So the big question is that how does silicone improve scar? So just to sum up this diagram on the mechanism, when silicones are applied over the scar, they provide an occlusion mechanism that means they seal off the skin surface, and that provide the hydration to the top layer of the skin, which is called the stratum corneum, which is the rough layer that you feel on the skin. And these can actually down-regulate the keratinocyte. Keratinocytes are the immediate cells that you have on your skin. So this reduces the stimulation to this keratinocyte, because if your skin is dry, your skin loses water, then it stimulates the keratinocytes. And the stimulation of this keratinocyte can actually prompt the cells below the fibroblasts to actually produce excessive collagen. So this can, by hydrating the surface skin, you can actually reduce the signaling and reduce the stimulation of collagen production. However, this is a very gentle, mild mechanism that we sometimes hoped to have better efficacy, better result. So therefore, we don't typically routinely advise patients that all patients should apply silicone gel sheets, because silicone is actually quite expensive if we were to buy it commercially. So what we have thought about is that, can we use a therapy that has the physical function of silicone? And in addition, unlike the inert silicone that doesn't do anything beyond the physical function of just covering the surface of the skin, can we have a bioactive function also that reduces this production of collagen? So let's look at how scars, again, how is it formed? And once again, this fibroblast, I've been talking about it, the excessive secretion of collagen will lead to excessive accumulation at the wound site. And excessive collagen deposited in the wound will result in these raised scars, visible scars. If they are not too bad, they are hypertrophic scars. And if they are beyond the surface, beyond the line, the wound area, you call it keloid. So that's how we differentiate. When it's within the wound itself, we call it hypertrophic scar. And if it goes beyond the wound, we call it keloid. And keloid is actually coming from this Latin word called crab. It is like a crab that goes beyond its boundaries and invade the surrounding tissue. So what we're trying to do here is that, well, can we inhibit this excessive collagen deposition at the wound? So we must always think of a balance. We want to inhibit, but we don't want to cause side effects. It's easy to inhibit everything. We can use steroid to inhibit everything, but when you use steroid, it actually causes the skin to thin down. It can cause the blood vessels to be very prominent. It can cause many other side effects to the skin. So we don't want this to happen. So we're thinking that, can we do something very safe, something that people can even have access to it immediately? Because I always talk about early treatment, early access, and you can get much better outcome when you treat manage the wounds early. So we're thinking that perhaps we can inhibit this collagen protein in a very specific way with little or no side effect, because when we talk about prevention, safety is of utmost importance. So recently you would have heard about very much about mRNA because of COVID. mRNA vaccines you give to people to produce the protein that you don't have, which is the COVID vaccine. But in this case, we want to do the reverse. We have too much collagen. Can we specifically inhibit the RNA that produces this collagen, excessive collagen? We can inhibit them by the different measures, right? And I'm just going to talk about one form that we have been researching over the years, that is silencing RNA. So how does this silencing RNA actually work in general? This silencing RNA will find the mRNA, which is actually the messenger RNA that produces a protein, the protein. So it just binds to this very specific mRNA, and it breaks it down very specifically. So the idea is that we want to have a very targeted reduction in this particular protein without affecting other proteins. The key problem of this kind of therapy is that a lot of times you can actually just put in a tube and then put in a gel or a cream. But the question is that, can you actually deliver all these active ingredients into the skin, into the cells that you want to target? So you can see a lot of products in the market. They have this and that, this and that. Yes, I mean, in cellular work, it can work. But in real life, our skin is impervious. Our skin will repel many things that you try to put on it. And so the key is, how do we get it in the good active ingredients into the skin that we want it, to the cells that we want it to go. So what our technology research has been is that to use a nanopolymer to actually bind to the silencing RNA to protect it from degradation. Beyond that, on the polymer, it also has this ligand for the receptor on the fibroblast that we want to target. So it will go to the cells that we want it to go to, and it will try to, it will avoid the other cells in the neighboring space. And to deliver into the skin, we have been using a dissolvable microneedle made of hyaluronic acid. So you would have heard of hyaluronic acid. It is a form of a very good moisturizer they put in the skin. This is something naturally produced in the skin. So the technology here is actually to make this hyaluronic acid, make it into a solid form, make it into a needle form that you can just apply, and it can just penetrate the top layer, just the top layer of the skin. This is where how our skin actually repel a lot of things that you apply. This top layer, so we just want to penetrate this top layer a bit, very tiny, very shallow penetration, and then deliver the payload down beyond. And so this is how we have developed this therapy, in which we actually load the silencing RNA with the nanoplex on the tip of the micro tips, and put it in the form of a patch. And this patch can be applied onto the skin to deliver this silencing RNA onto the top, just beyond the top surface layer of the skin. And so we actually did a lot of cellular studies. So these are human fibroblast study where we demonstrated the knockdown of the protein. We also demonstrated reduction of collagen in the mice wounds, and this is our publication there. And after that, we move on to human skin, where we apply to the skin. We look at the imaging, live imaging, to see that the microneedles has penetrated the top layer of the skin. And we did a clinical trial in which we get patients who have undergone surgery. We split the wound into half and half, random selection. One side we put silicone sheet, the other side we put a silencing RNA patch. And then we compare over time, 1 month, 2 months, how are the wound formation, how are the amount of elevation of the scar is. And we're trying to see which side actually heals better, flatter. So we use a high resolution 3D scanner and we measure the volume, scar volume over 1 month and 2 months. And over this period of time, 1 and 2 months, we can find that the site where the RNA patch was applied over the half of the wound, that site actually healed much flatter compared to the silicone sheet. So we want to compare with the convention. As I mentioned, the silicone sheet is just physical occlusion, whether we can use a RNA patch to provide not just a physical occlusion, but also additional beneficial effect. And when we look at the graph chart, we compare the two sides, we can see the volume reduction in the red bars, which are actually the RNA patch size. There is a greater reduction in the scar volume over time. And we have recently published this in the British Journal of Dermatology, this clinical trial that we have performed. And also we have subsequently performed different clinical trials, which are yet to be published. And here we come out with this product called bioRNA, using these principles to enable people to actually prevent scar formation. So in summary, I think the theory is that the principles have been that we use this patch where we have this RNA ingredient, and then we want it to go into the cells that actually produces collagen. And this all in the aim of reducing excessive collagen deposition. Because all these thick collagen bundles is what that produces thick scars. And how we want to make it very useful, easy to use, user-friendly, where well, anybody can use it. You can pick it off, buy it, and then you can use it early. And whenever there's a need arise to reapply, one can just reapply. So it's like a tape. Just tear it open and just paste it like the tape. We'd like to have it at least for 8 hours. So overnight application would be a great idea. If it's on the skin's exposed area, you can actually just take it off in the morning. So, but 8 hours of application overnight is something that we suggest. At morning time, you can let the wound dry. So for Caesarean scars, we have actually tried also applying. So this is an example of one patient, 6 weeks after use, the patient was quite happy with that. And we are thinking that we want to actually produce a patch that is tailored for Caesarean scars, also beyond this microtips patch that we have for general wounds. General scars, we want to have one specifically more comfortable for this pubic area, and this is a specific Caesarean C-section and sensitive skin patch that we are looking to produce by the end of this year. So I think we have a lot of professionals here, like when you take care of postpartum ladies, sometimes you wonder, okay, after taking care of the wound, helping prevention, and sometimes things still do not go so well. So when to refer your clients to a dermatologist. So when there's persistent pain, thickening, itching, or there's a concern about hypertrophic scar or keloid scar. So keloid scars are like that. So we don't want it to be don't want it to be until then the patient comes, but sometimes it happens, and so we have to start treatment for these types of exuberant scars. And sometimes the condition is really bad, and that is when you can consider referring to the plastic surgeons. What they do is that they do severe scar that needs excision and resewing to redo the procedure. Usually we don't like to do this because the scars invariably they will recur. So cutting something out and redoing the wound, most of the time you imagine that, okay, that would solve the problem. But unfortunately, in 50 to 100% of the cases, if you just simply redo the surgery, the keloid will actually recur. So we try to avoid until we have no problem, like for example, until we have no choice. Like for example, when there's functional impairment, because the scar is so thick, it causes teetering pain with movement, or some patients are just so distressed by the appearance of the scar, and then they want just to cut it out. So if that happens, then we have to think about how do we prevent the recurrence of the scar. So traditionally, when you refer patients to dermatologists, what do we do? Well, the most common and most often the only way that we treat the scars is actually using corticosteroid injections. So we basically inject the steroid into the thick scar, and this process is about once a month. The patient has to come back every month until the scar flattens. However, as I mentioned just now, this exuberant scar, there's excessive production of collagen, and sometimes it presses on the nerves. The keloid scars are actually very sensitive. You touch them, the patient can even feel pain. Inject them, many a times patients cannot tolerate. So this is a big issue that we face also. And previously, many patients do not get treatment because of that. You cannot tolerate the injection. So we have no good treatment to give to the patient, unfortunately. We try other means like liquid nitrogen. It doesn't work very well also. So what I've also done is to create a sort of a device that actually produces a vibration to try to numb the skin area. This helps with the numbing the area for a while during our injection, but once again, this has a limited effect. Well, we can also try to use laser. I think everybody thinks of laser. Laser sounds a very fanciful name. But for scars itself, it has also very limited function. When we use the laser, like pulse dye laser, it primarily reduces the redness in the scar. It doesn't really reduce the scar volume by itself. And so that is not really very effective, but it is more an auxiliary management option in which you want to reduce the redness. Now, there are actually another laser called fractional carbon dioxide laser. It promotes collagen remodeling, but once again, the effect is limited, and sometimes we're afraid that it can cause further growth of the scar. So no choice, then we go for surgical revision, but this is only the last resort when these severe cases, other treatments fail, and these we usually send over to plastic surgeons to try to get them to have the technique to minimize the tension in the wound. So sometimes they may cut even the wound in a very like a funny manner, like a zigzag manner, instead of a straight manner, and like Harry Potter scar, yeah. So that is actually to reduce the tension, so that it doesn't cause the pull and the recurrence of the scars after the surgery. So the other question that we ask is that, oh, okay, in this case, unfortunately for some patients, the scar has already developed. Can we also use this RNA patch for self-management of established scars? The rationale is that this RNA patch can be bought without a prescription. And so once again, we talk about early management. I mean, most of us don't want to go and see a doctor unless we have to spend the time and money to see the doctor. And sometimes we don't want to try some therapy first to see if it works for us. And so this RNA patch we also apply to patients with established scars. For example, in this case, not a Caesarean scar, but a scar on the elbow, which is actually more difficult to treat because this is a joint area, a thick skin area. So a hypertrophic scar in this patient, we have this on the left to the right side. She applied on this 6-week-old scar. She has quite a bit of pain. Allodynia means that when she touches something like her clothing even, she gets a lot of pain, very sensitive. And after 2 days of application, and after 5 days of application, and after 22 days of application, this has much reduced. And she's now in the UK, and then she's so we could also send some of these patches over for her to use. And for patients with keloid, this is one patient that have used it. This is a keloid on the knee, and this is a photo at 2 weeks after application. He actually applied the patch only on the right side of the photo, and this flattened, and on the left side, it wasn't applied because this is actually in a strip format. Our patch is actually in a strip format, so this patient can only apply onto one side of the keloid scar. And then this is helpful for this patient. So there are cases that this can work. Patients can self-apply this treatment and see whether it works for them. And if it doesn't, then go and see a dermatologist for the steroid injection plus minus laser. So this is how what I would advise patient, how I actually manage my cases in the clinic. To prevent exuberant scarring formation, I would give patients the microneedle patches, RNA microneedle patches, applied nightly for 8 to 12 hours. And after surgical stitch removal, which is typically at 2 weeks, the patient can actually start applying these patches, and to apply for 1 to 2 months after the surgery. If need be, it can apply longer. There's no harm to it. Well, if it's not suitable, because sometimes you can get rashes, because some patients are sensitive to the plaster application. Well, you can go on to the silicone gel sheets or silicone gel, but these are less effective. In terms of treating exuberant established scars, especially those with symptoms, we want to use something that reduces the collagen fast. And this, we use a standard intralesional steroid injections, inject the steroid into bit by bit into the different parts of the scar. And if it's painful, we can add on our pain numbing device and use pain numbing cream to try to reduce the pain of injection. Well, if patients are still feeling a lot of pain, unable to tolerate the injection, we would actually give them this microneedle patches, the RNA microneedle patches. Well, in National Skin Center, we also put steroids into our microneedle patches. So for patients, we may actually use the steroid microneedle patches also, but unfortunately, these steroid microneedle patches are only available in the National Skin Center clinic, and is not available elsewhere. So yeah, I still got to see a doctor over there to queue up, and it takes quite some time. Well, if the scars actually recur, which often they do, we want to rapidly start management early by getting patients to apply the RNA microneedle patches. And once again, the earlier we treat, the better, the more efficacious it is. And just to talk a bit about adjunctive treatment, many patients can have pain and itchiness in their scars, and we use topical therapies like this Subam cream, this Subam spray even, to actually help reduce the sensation, to apply anytime. These are actually anti-itch relieving moisturizers. And for patients with redness in the scar, sometimes we may use a pulse dye laser. We may use fractional CO2 laser to help with the process. And sometimes some doctors even use micro Botox, a little Botox into the scar. So these are not the mainstream. It will help with our mainstay of treatment. But these are the one on the right side, the adjunctive treatment, are auxiliary to help add on to our mainline treatment. So just to conclude, there are various factors causing the bad or good scar outcome, and we want to maximize those that actually help us improve the scar. What we can do to control post-op infection, reduce it, provide additional wound care, better nutrition, reduce the mechanical stress that we subject to the wound. So the support that we can give to our pregnant, our postpartum ladies will be, and this is a period where there's a lot of stress already, and so we want to actually help them heal better, take their mind off this additional issue that they have to deal with. So firstly, to keep the wound clean, we want to sun protect. We want to watch for infections, poor healing, and to actually treat them if there's infection. Treat them early. Want to have a good nutrition and health. So that comes with reduced stress also. And not just mental stress, but mechanical stress is very important. Like how I mentioned, using the supportive garments that you can actually prevent the tension across the wound. Gentle massage therapy after the wound has healed at about 3 to 4 weeks. And if you have any questions, or your clients have any questions, our postpartum ladies have any questions along the way, we want to have somewhere that they can at least get some information, basic information. So you can actually scan this QR code, where this is our ScarBot, what we call a ScarBot, where it's a customized large language model where you can ask specific questions about scars and what new therapies they are. So we need to create one, because if you just use the usual ChatGPT, it doesn't really give you the most advanced treatment. And in terms of therapies, when you see a doctor, what do? We can use this bio-RNA patch, but this one you can actually buy it yourself first without prescription. We can use the anti-itch moisturizer also. You can also buy it without prescription when in any pharmacy. You can also buy silicone gel to try first. But in general, silicone gel, the effect is rather equivocal. It is not wonderful, and so we don't routinely suggest patients to use that. When it is bad, patients have established scar, we'll use the injection with steroid. This is the mainstay of treatment for most doctors. And in National Skin Center, we can also use the steroid microneedle patch, but this is not available elsewhere. We may add on lasers to help with the reduction of scars, improvement of the redness. And if it's come to worse, no choice, then we will opt for scar revision, and we typically send to our plastic surgeon colleagues for larger, more severe wounds, scars. Yeah. So I think overall, this is our strategy to actually improve the scar outcome. And I think we want to support our postpartum ladies as much as possible during this time. Is a very stressful period. Babies to handle and lots of concerns, and we are trying to see how we can minimize that and help them with the healing process. And I thank you for your attention, and I will welcome any questions after the other speakers, or you can put it into the chat box. Thank you.
Amazing, amazing, Dr. Tey. I'm really happy to have heard your presentation. And I'm so glad that this is quite a breakthrough, I think, this plaster. And especially hearing that you're working on one that is specific for C-section scars is very good news for all our mummies out there, I think. So thank you so much.
Thank you. I shall stop the sharing. So Joanna, I think...
yeah, thank you.
Thank you.
Great, wonderful. Thank you so much. As Dr. Tey said, we will take your questions after. So if you have anything, pop them in the chat and we will read them to you at the end. But we're moving on now to our next very special guest, Dr. Maithili Pandey. Dr. Maithili is a family physician. She's an international board-certified lactation consultant. She's also the director of Mother and Child, which is our premier outlet, I think, for any needs regarding your prenatal journey, postpartum care, lactation, and parenting. And they are there to provide holistic and evidence-based care in the wild ride that is parenthood, basically, especially in these early weeks. She's also the lead trainer for the Breastfeeding Mother Support Group, and she has a wealth of information that she also uses to push forward policies and practices to support breastfeeding families for the Association for Breastfeeding Advocacy in Singapore. And today, I've invited her to talk to us about exactly what Dr. Tey was mentioning earlier. How do we reduce the mechanical stress on this C-section scar while at the same time needing to feed 2 to 3 hours a day and even more? And it's actually regardless of whether this is breastfeeding or whether it's bottle feeding. The pressure on the scar is definitely there. So Dr. Maithili, please take it away. So happy for you to be here and spending your lunch time with us. Maithili, you need to unmute yourself. Yeah.
Yep, I'm here now. Can you hear me?
Yes, I can. Thank you.
Okay, well, thank you for the beautiful introduction, Johanna and Dr. Tey. Hello. I am here going to talk about challenges of breastfeeding a newborn after major abdominal surgery, because you and I know how challenging it can be just dealing with a newborn, whether or not you have a C-section or even a normal vaginal delivery. But now that we have had mothers with major abdominal surgery, like a C-section would be, I think we will have to really think about how we're positioning the baby, what are the issues that moms face after a C-section, and how we can reduce the stressors. All right. So feeding a newborn isn't easy, right? But definitely after a C-section, we have so many issues to deal with. The pain, for one, the hormones all over the shop, and of course, needing to hold the baby up. And this is a 3.5 kilo weight potentially that we'll have to constantly hold the baby onto the breast as well. So it's going to be quite a challenge. So let's break it down, okay? We're going to be talking about how breastfeeding and the milk production can be delayed after a major abdominal surgery, like a C-section would be. We'll talk about various feeding positions that can assist with dealing with a whole C-section, and what are the support systems that we have. So Dr. Tey had alluded to some of the mechanical stressors, and this is where the feeding positions will be quite helpful. And I've got my beautiful colleague here, Heather, who's going to help us with some of the positions. She's going to demo the positions for us. Okay. All right. We know that after having a C-section, the milk production can be delayed, and it happens quite often, actually. So depending on whether you've had an emergency C-section or a planned C-section. So with an emergency, just the whole stressors of not having the birth that you wanted, not being able to get your mindset right, all of this actually has an impact on the milk production. As you know, milk production is really governed by our hormones that go right through our brains onto the breast and every other part of our body, versus having a planned C-section where you have already gone through the whole process in your head that, yes, I'm going to be cut, I'm going to have my baby out, and I will be in pain. So you have had time to process these things. There will be a difference in the hormonal surge after a normal vaginal delivery as compared to having a C-section. And this would also have an impact on how the milk production gets kicked in. So typically after a normal vaginal delivery, milk will come in about day 2, day 3. But we have known now that after a C-section, milk only comes in after day 4, sometimes after day 6. And it can be very frustrating for lots of moms, but we have to remember that this is normal, okay? It is part and parcel of the whole healing process of the C-section. So it's expected. Don't fret. We are here to help. How do we kickstart the milk supply? We talk about harvesting colostrum before birth. And this can be something that moms can do to just get the milk production starting early. So week 36 to week 37 of the pregnancy, most moms would have their babies only after week 38. We can start by hand expressing some of the colostrum and collecting it. And this can be used for the baby in the first couple of days right after birth, just to kind of get the whole process kick-started. And once the milk has been removed from the breast just kind of get the whole idea that it needs to be constantly making more and making more. We often talk about speaking with the obstetrician way before you harvest colostrum, just in case you have had a high-risk pregnancy. This may have some potential side effects, right? We talk about feeding the baby or even hand expressing right after birth. So when you have your baby skin to skin, as soon as the baby's born, they actually will be able to find their way to the breast, and they have all of their inborn reflexes, rooting reflexes, sucking reflex, and the swallowing reflexes, going right from the very start. So as soon as you have your baby born, putting them right onto your skin and allowing them to suckle onto the breast at the very start will make an impact on your milk supply as well. And for whatever reason, if you can't get your baby to latch on, or you have to be separated because there's an emergency, then we want you to start hand expressing and potentially pumping right at the very beginning as well. This all helps you kickstart the milk supply if you've had a troublesome birth. Okay. So now we talk about the positions that usually work and my favorite positions, okay? I've got Heather here to help me out with this. One of the first positions that we talk about is the gestalt breastfeeding position. And it is really—
Dr. Maithili?
Hey.
Sorry, Maithili, can I ask you to maybe stop screen sharing so our viewers can have a full view of what Heather is demonstrating?
Good idea. All right, can you see this then? Okay, so this is the gestalt breastfeeding position where I'm going to get Heather to kind of lean back into the chair. We're going to have a footstool for her, so you might not be able to see where her feet are, but you can see that she's going to be a lot more comfortable. We're going to get her to hold the baby really skin to skin onto the breast, right? So yeah, we're not having her skin to skin, but you cannot know that she is really plastering the baby onto her chest. You're going to get your arm pulled away from the baby a little bit. The baby is nose to nipple, and the baby's tucked right under the other breast. Move your arm down and place your hand over that, so you're pulling the baby into the breast really comfortably. This is called the gestalt breastfeeding position. So the mom is really relaxed. She's leaning back onto the couch, and her baby's plastered onto her. So there's really no way that the baby's going to be moving around very much. The baby's not going to be leaning back, and she's comfortable. Baby's really comfortable. Most babies are very comfortable in the ventral position. That's when they're tummy to tummy with the mama. So this is the gestalt breastfeeding position. It's also known as the modified cradle. And as long as the mom's knees are higher than her hips, she's not going to be putting undue stress on her lower abdomen where she might have had the C-section scar. That's really comfortable, especially also because she's tucking her pelvis under, and so she's not sitting upright too much. That helps too. Okay.
So basically what this is doing is gravity is pulling the baby towards the mom's chest wall rather than downwards towards her abdomen and the scar.
That's it. That's exactly it. So, correct. And so the baby's actually in the valley between the breast and the rest of the womb, right? So
Amazing.
snug, very snug. The other thing to note as well is that the baby's arms are on either side of the mom's breast. So then the baby's not tucking the arm under. Do you know what I mean? So you're really kind of plastering the baby skin to skin onto the mom or chest to chest.
Perfect.
That's one position. The other position is a side-lying position. And that will be a bit challenging to demonstrate right now. But I think as long as you can sort of visualize it, let me use my puppet, okay? My very famous puppet. We usually want our babies to have their nose to the nipple. So when you have the baby's nose to the nipple, they will be forced to open their mouth wide open and tilt their heads backwards. So from there, tilting their head upwards and taking the breast into their mouths. So then they are going to get a really good mouthful of breast tissue, and it's going to be safe for the mother because the nipple's not going to be chomped on like that. It's going to be way into their mouths. So that usually helps as well. So when you're having a baby side lying, this position often tends to help too. So the baby's going to go nose to nipple, and then they open up their mouths and take a good mouthful of breast tissue. Any position where the mom is going to be sitting upright is not a position that I would recommend. So in the traditional cradle, moms tend to hold the breast and hold the baby, and they end up reaching forward and leaning forward. And that's going to put a lot of pressure on the lower abdomen, right? And do you see that? Yeah, she's leaning forward. So it's almost breast to the baby, and the baby's resting on the lower abdomen at the same time. Not ideal. And then the other position that's very commonly thought in the hospitals as well is the football hole. So in the football hole, moms again will be holding onto the breast. Try to hold onto the breast, yeah, that way. And then they end up holding the baby right across, and they are tending to lean towards their baby. So again, a lot of mechanical stress on the lower abdomen at the same time. Again, very, very painful, very uncomfortable. And often babies don't get a good mouthful of the breast tissue either. So not an ideal position. So coming back to, let me see if I can screen share again. So my favorite positions would be the position that I showed you, the modified cradle, a side lying. So you're really comfortable using gravity to kind of hold your baby onto the couch, and you're pulling the baby into the breast. And football hole when done properly. So that's my takeaways from that position. So this is the gestalt position. So this is where the baby is really plastered onto the chest wall. You can see that the hands on either side, there is enough room for the baby to move around in. Yeah, and you can see just the nose lifted off the breast tissue, which is fantastic. That's exactly what we want. We don't want to be holding onto the baby's heads, because they end up pulling back away from the mother's breast when you push the heads in. And then you have the sideline. Okay, so you can see here that the mom's really pulling the baby into the chest wall. The baby's really comfortable. Moms end up being super comfortable. There is a pillow between their knees so that the hips are neutral. They're not tucked into the pelvis a little bit too much either. And in this position, most babies are very happily suckling and nursing. Okay. Positions that do not usually work would be the football hole, again, because it tends to be pulling onto the wound quite a bit. The cradle, the cross cradle, because I find that moms tend to be reaching over onto the breast and putting the breast into the baby instead of the other way around, where you're leaning back and getting the baby onto the breast. Now, any other position of the mom's leaning forward, these are the positions that tend not to work. Okay, so this is a correctly done football hole, although I can quite easily imagine that this baby is probably pictured, right? So it's taken quite nicely demoed, where the baby's got a good mouthful of breast tissue and looks quite comfortable. Mom looks quite comfortable as well. And in this position, do you see how the mom's sort of leaning forward? She's twisting her torso as well, and the breast is to the baby. Not an ideal position. Can you see that the hands are between the mom and the baby? So that's going to be tugging into the breast quite a bit as well. Very uncomfortable for the mom, I can imagine. Okay, let's talk about the pain meds. Now, we know that spinals and epidurals have really not much of an effect on milk supply, but opioids that are sometimes given in an epidural can be affecting the milk supply, because the babies would be getting some of it in their bloodstream as well, and it can cause some drowsiness. Antibiotics, even though they're given prophylactically, meaning they're given routinely to mothers after a C-section, it can cause a change in the microbiome, which is the good and the bad bacteria balance in the skin, the bloodstream, and the breast at the same time. So sometimes I find that when moms are given antibiotics, it may increase the incidence of yeast infections on the breasts. Sometimes IV fluids, when they're given for long periods, especially when there's been a very, very long labor, it can cause some breast swelling, which might cause pain, number one, for the mother, but also for the baby. They might not be able to get a good mouthful of breast tissue, and that could be quite painful as well for the mother when she's trying to breastfeed. Sorry about the pictures again. Oh, hang on. I think I'm going the wrong way. Apologize. One sec.
That's okay.
Okay, there we go. Okay. The bigger picture is we want you to remember that recovery, feeding, and sleep deprivation is the most challenging combo that happens postpartum, right?
Yeah.
Because you're in pain, you're trying to feed, you're making sure the baby's fed, and you're ridiculously sleep deprived. None of us, even if you've done shifts for long periods of time, 36-hour shifts, I still feel like those are a bit more manageable compared to the postpartum period. It's the worst combo on earth. But you also want to remember that Karen's baby is not your baby. Your friend could have had the best postpartum, but it's not the same as yours. No one can ever be in your shoes. What I often recommend to moms is get plenty of skin to skin. That is the one thing that makes a huge impact on being able to breastfeed your baby. And rooming in, meaning having your baby in the same room as you, so you can watch their cues. As soon as they start moving around, picking them up and putting them right away, skin to skin onto you, is the best thing to do. Okay, instead of having the baby with a confinement nanny or with someone else or in the nursery, the worst case scenario that would be. Let's not do that. Let's have the baby right there. Get someone to help you pick the baby up, strip them down, put them skin to skin, and most of the time it works quite well. But don't watch your boobs, watch the baby for cues, right? Support systems are gold. So this is where you get your husband or your partner or your doula or lactation professionals to help you, okay? And always say yes to help, because we're not meant to be living in a silo. Mankind has never been able to live on an island without much support, right? So say yes to food, say yes to laundry, say yes to emotional support, say yes to lactation support. Good quality lactation support is paramount in this period as well. And you've got this, right? Whatever happens, just think every single drop of breast milk counts, okay? But also be very patient with your body. Healing and feeding go hand in hand, and you've got this. That's all I have to say.
That's amazing. Thank you, Mythili, as always. Thank you, Heather, for being our beautiful model today. Loved it. Thank you. I think we got a very good picture of how we should be feeding post C-section. I think it was very good visual to see how it would reduce the stress on that scar, that mechanical stress. So thank you very much, ladies, and we'll move on to Vanessa. Thank you so much. So it's wonderful to see you, Vanessa. I've invited Vanessa because she's really one of our foremost and most experienced dietitians that we have here in Singapore. She has over 20 years experience working in this field, and she's worked in so many different countries around the globe, not just in Australia, but where she hails from, but also the UK, India, and now Singapore. And she's working in her own practice called the Traveling Dietitian, but also out of Oslo Health and Better Life Psychological Medicine Clinic on a weekly basis. And I've really asked you here to share with us your insights on how good nutrition, wholesome nutrition, plays an important role in scar healing and recovering from birth in general, actually, because there's more than just C-section scars. There's blood loss potentially, and exhaustion, tiredness, fatigue, and so on. And also potentially what supplements could be used in order to aid healing as well. So thank you so much for joining us, and I'm happy for you to share your presentation now.
Great. Thank you so much, Johanna. And thank you to both Dr. Tey and Dr. Mythili for your very interesting presentation. So thank you for that great precursor. And I think that both Dr. Tey and Dr. Mythili have really highlighted the importance of obviously looking after ourselves as mothers, and the importance of optimal scar recovery, I think, is looking after ourselves, but most importantly, making sure that we're feeding ourselves well, looking after ourselves, getting plenty of rest, reducing kind of stress, which includes kind of mental stress and mechanical stress. But also, I think the benefit of just getting a really nourishing diet that's going to help us to get through this really tricky period. And as they both mentioned, recovering from delivery is hard enough, let alone having been through surgery at the same time. So I just wanted to talk a little bit. I'm going to keep it brief. I know I've got about 10 minutes or so. So just touching on a few topics. And I suppose thinking about what is the role of nutrition in wound healing. There are many roles that food plays. And I think one of them that there's been a lot of research done and really quite recent research, actually, a big study done in 2024, published in the Journal of Clinical Science and Medical Research, is really highlighting the importance of early feeding post-surgery as far as wound healing goes. So, trying not to delay feeding for as short a time as possible so that the mum is able to recover faster and her intestinal transit is going to be able to recover faster. So that means like a faster intestinal recovery that leads to shorter post-op stays in hospital and fewer complications that go along with that. So I think we just want to try and get food and nutrients into the mum as soon as is possible post-surgery. And so that's going to stimulate motility, and it accelerates that first passage of stools through the GI tract. And it helps the GI system regain its functions pretty quickly as well, the earlier that we can feed the mum. Obviously, nutrition is going to play a big role in things like restoring skin integrity as well. So that's by providing all the necessary building blocks like protein and essential nutrients for skin repair and maintenance of our skin as well. So there is a reduction in scar formation, and it does support that skin remodeling that Dr. Tey was talking about. Also helping with collagen synthesis, and obviously we don't want to be overproducing collagen, but adequate nutrition is going to help support that system. And another one is just supporting our immune system. So obviously the more nutritious the diet that we have, the more our immune function will be boosted as well, which can always help with scar recovery too. So this relies on a really tight glycemic regulation. So we want to be making sure that obviously a mother's blood sugar levels are pretty steady through this process as well. And obviously food can play a really big role in that. And another reason why we don't want to be leaving mum with too much time without food, particularly, let's say it's an unplanned C-section and they've already been through a long labor and probably not eaten properly during this time, even more of a reason to get her feeding as soon as is possible. So specific nutrients, I suppose, that we're looking at through this process. One of them, I think it's just making sure that the mother has enough calories. So it's just trying to get her eating proper food, eating regularly and eating balanced meals. Now, obviously, this is helpful for milk production as well. But for that wound healing process, there needs to be adequate calories for the body to be able to support that process. Definitely, and again, touching on what Dr. Tey mentioned, that, adequate hydration, obviously both for the skin directly, but for the mother as well. We need adequate hydration for her to be able to maintain that moisture in the skin, which helps to aid skin recovery, but also to promote elasticity in our skin as well. Also with milk production, adequate hydration is important too. So it's just trying to encourage regular fluid intake, whatever that might be, whatever the mum is preferring at the time. And of course, I suppose one of the big nutrients we really focus on is protein, which is essential for that tissue repair and wound healing, but that's what is going to help to include kind of collagen production and elastin production as well. So, protein's always a buzzword, and we don't need huge amounts of protein, but what I would say for a new mum post-op is more having little and often, trying to have a protein source regularly across the day, not kind of loading it all up into one meal, because we're less likely to be able to use it effectively if we have kind of all at once, but trying to include regular sources of protein. And, this is just a bit of an example of, a mum doesn't need to be having 20 to 25 grams of protein by any means. But this is just an example of, some protein sources. So having obviously some animal sources of protein, but also things like lentils and chickpeas and beans, nuts and seeds, things like edamame or cottage cheese or yogurt. Now, something obviously we need to think about is being practical post-op, and it's just making sure that, you know, things like a handful of nuts, so that handful of edamame, drinking a milk drink or eating some cheese or eating some yogurt. And we often need to think about a mother really having to eat one-handed, you know, because she's generally doing plenty of other things at the same time. So just trying to keep that protein intake quite practical. As well, things like vitamin C. And again, Dr. Tey touched on this. And so thank you, Dr. Tey, for highlighting the precise nutrients that I'm also going to be covering. So just to confirm that. So vitamin C is really important for that collagen synthesis and for scar healing as well. So trying to encourage, you know, fruit and vegetable intake. They don't need to be huge amounts. And, you know, if the mother is finding it difficult to be getting adequate fruit and vegetables in her diet, a vitamin C supplement can be warranted, but probably isn't if she's getting some fruit and vegetables in her diet. Zinc is another really important nutrient, mostly for, it's really known as the wound healing mineral, I suppose. And so it's promoting lots of new tissue and helps to maintain that skin's barrier function as well. So zinc is actually in a variety of foods. So fortunately, you know, good sources of zinc include seafood, oysters are particularly well known for zinc, and red meat, but also legumes, lentils and pulses, things like nuts and seeds and whole grains, and also dairy products. So really, when you look at that, if we're having a varied diet, it should be easy enough to be meeting our zinc and our vitamin C requirements through food. And then I think another one, and again, Dr. Maithili touched on things like our microbiome. So when we're looking at things like our gut microbiome and our skin microbiome, we do, particularly for our gut, we want to be making sure that the mum is getting enough fiber to support gut health, but also, and to promote that gut-skin axis that's developing, but also to prevent constipation, which can be common, you know, post-delivery, and particularly if medication has been used and things like that, constipation can be more likely. So I think just trying to get the gut moving faster is just trying to get a steady intake of fiber into a mother's diet. So going for different types of fiber, so things like oats and nuts and seeds and whole grains providing a soluble fiber, also fruit and vegetables to get some insoluble fiber in there, and then even some resistant starch from things like cooked and cooled starches like rice and pasta and potatoes, if possible. Again, it's just looking for variety here as much as possible. But I suppose we also have to recognize the practicality of all of this and the logistics of feeding a new mum who's extremely busy. So I will reiterate what Dr. Maithili mentioned about getting support. And if anyone is asking, what can I do? I would always suggest to a new mum, ask for food. Ask for ready-made snacks that are able to be eaten one-handed whilst feeding at the same time. You know, I guess if it is a planned C-section and if there's opportunity to be able to batch cook meals beforehand and have them in the freezer so that they're ready to go. But I think just having really accessible snacks like smoothies are fantastic because they also tick the hydration box, as well as being able to throw in as many different nutrients as you can into a drink that can easily be drunk one-handed. And things like energy balls and nuts and, you know, cheese and crackers and hummus and things like that are all really kind of easy to have on hand. And then I think just making sure that there's always fluids. Obviously, to new mums, we're always promoting fluids, but just another reason for wound healing is just keeping a bottle there on hand to top up and sip on regularly throughout the day. And just a reminder to try and be feeding a mum as early as possible post-op. So that is nutrition for wound healing in a very concise nutshell. Thank you for listening.
Amazing. Thank you. And sorry for having to limit you to the 10 to 15 minutes that everybody gets. This was very insightful. I think the hardest thing for moms post C-section is to be feeding quickly after the procedure because they typically can't eat for the next 6 to 8 hours under the anesthesia, and then it might be in the middle of the night, and then it's difficult to get food. So that's a really important reminder to pack your snacks before your birth as well. Thank you so much, Vanessa. This was really great. And I hope we have Monica and Tamara on the call now from Physio Down Under. And you can start your videos now. Amazing. Okay, while they're joining, I just wanted to talk a little bit about Tamara and Monica. There they are, beautiful ladies. Thank you so much for joining us today. So these two ladies are the co-founders and co-owners of Physio Down Under, which is really Singapore's first pelvic health physiotherapy clinic. And they have over 40 years combined experience with a special focus on pelvic, obstetric, and gynecological conditions. They worked at other clinics before, but then decided to join forces in 2018 and open their own clinic, which we're very grateful for. And it is really the first of its kind because it is so focused on women's health physiotherapy. So thank you for joining us today. I love your topic, which is all about mobilizing the scar and telling us a little bit about, scar adhesions and how they can cause discomfort. And yeah, so take it away. I've got your videos in the background, so just tell me when I need to share them.
Okay.
Well, thank you for having us.
We're very excited to be here.
Yeah.
So do you want to start?
Yeah, so we usually see women at 6 weeks postnatal for both either after a cesarean or vaginal delivery. And always at that 6-week mark, we will have a look at a woman's cesarean scar if she's had a cesarean, and we will introduce the concept of scar massage at that point.
Yes, and I just wanted to point out, we don't have any presentation slides, but we decided to do a video that Johanna helped us put together just to really show what we do, hands-on techniques, and what do we do at the different time scales. And that's the focus of what we are talking about today. But I just wanted to point out that we have this booklet that Johanna's very kindly, quite a few of the doulas, I know that Maitili at Mother and Child is also helping pass to clients. And it goes through, especially looking after the scar in the first few days in the hospital. So one of the things that we do know is when pain is better controlled from the beginning, that the C-section scar recovery, the whole experience of it is obviously a little bit smoother. And so it just goes through all the different steps of supporting the wound with a folded towel or a small cushion, getting in and out of bed, learning how to protect and support the scar when you cough, sneeze, laugh, or as Vanessa was saying, hopefully we don't get people to get to the constipated stage, but if women, when they're going for their first bowel motion, to support the scar as well. And the booklet then goes through lots of different exercises, but at the end, we also do have a section on massaging the scar, which we will talk more in detail during the video. And if Tamara wants to say anything else?
No, I think let's watch the videos and then we can, if there's anything that we've missed, then we can talk about it.
Okay, bear with me. I had some technical issues before, so I hope this will work now.
Oh, gosh. Oh.
From the beginning, after you've had your cesarean section, you can start with some diaphragmatic breathing, which is a lovely calming technique. And so Monica's going to demonstrate this to us. So you can pop your hands on the side of your ribs, and Monica's going to breathe in, directing the air into the bottom part of her lungs. You can see her hands are expanding. You can see her belly is lifting. So she breathes in, and her hands by her ribs expand, the belly lifts. So we're getting some movement of the scar right from the beginning. And you can do anywhere from 3 to 10 breaths at a time, and as often as you want to. There's no problem with that, and it should not be painful. Then at about 4 weeks post-cesarean, we would start with some lymphatic massage to help drain any swelling that might still be in your belly. And your nearest lymph nodes where the swelling, the fluid goes to, is underneath your ribs over here. And when you do lymph massage, you're going to do it like you are stroking a cat, so not too firm, not too light. You're going to start, so Monica's going to demonstrate. She's going to start below the scar, and she's going to stroke up to just under her ribs, one hand after the other. That's it. Following up it. So you're imagining you are moving that fluid up to the lymph nodes where it's going to be drained. And you can do about 25 strokes in total, and you can do that in the morning and the evening. This should not be painful. If it is hurting you, please don't do it. You can wait another week before you do it. Then at about anywhere between 4 to 6 weeks, it's once that scab sort of has come off and the scar's looking quite nice and healed, you want to start with some desensitization techniques. And you can do that by using different tools that have different textures. So you can use, so like a cosmetic brush, and you sort of just doing that along the scar. So it's getting used. So this should definitely not hurt, because it's very normal for the first 3 to 6 months for the scar to feel a little bit numb. That is very, very normal. And you can also try with like a face cloth, running it along the scar. Yep.
You can do it above the scar as well, where often people feel it's numb.
Yeah. And so that brings us to about the 6-week mark, which is where we're going to start now actual hands-on massage, which Monica's going to demonstrate now.
Yeah.
Okay, would you like to add something in the meantime, or should I go straight on to the next?
No, I just wanted to make a comment that the lymphatic massage I was talking about is not actually MLD, which is manual lymphatic drainage. So it's just a form that we use of massage just to help move the fluid along. Okay.
Mm-hmm.
So yeah.
Got it. Okay, so then we'll move on to our next video.
Okay, so now we're going to show some hands-on techniques. This is from 6 weeks on. So at 6 weeks, it still might be quite tender. So we're going to work at the superficial layer of the scar. So thinking about that first movement of layer, we're going to hold onto the scar as if you're holding, and this is what I'll be teaching patients as well, to find the scar with their finger pads and then moving that scar up and down on that superficial layer. And then we go around in circles, circular motions, holding that scar, and then around to the other side. And for the sake of brevity today, I'm only doing a few seconds, but you want to make each direction last about a minute, maybe, and then going side to side for a minute. Okay. Then other techniques that we will then, as time progresses and that scar becomes less sensitive and definitely more healed and stronger, we can start going a little bit deeper into that, but also pulling and mobilizing that whole tissue. So right onto the scar, one technique to do, and this can be pinpointing a part if it's a bit tighter on one end, and lifting, pinching and lifting that scar and releasing. So we can really pull that skin up and hold and release. You can do that along the whole scar to lift and release. And another technique is to go transverse wise. So you're rolling the scar as we go along. You okay? Oh, okay, so moving along. And this might feel more comfortable with some oil, but you lose then the grip in the skin. So rolling that scar along. Okay, and many of these techniques, if women who have that shelf over the scar and everything is very tight here, we also will be working similarly on this tissue above the scar that we can do. We can lift. Harder to get into here. And move that scar. These kinds of things that we can be doing. Okay, and then another thing that we use in clinic, a little bit of cream now that I will put over our scar, and Ellie is using the cupping. So this one, we just want to go right onto the scar again. And as you can see there on the video, we get a bit of that skin pulling up, the tissue, and we will move that cup along. You can also pull that scar, just like we did with the fingers, and move along and create a little bit of more of a mobility of that scar in those tissues. And this is comfortable. It doesn't hurt, right? It generally feels good. You can do different directions here as well, doing a little bit of circular movements. The idea is really to mobilize the tissues in lots of different directions. Okay, and with the bigger cup, we can work in this area above the scar. So get a bit of that lower belly skin, and you can see how much the tissue comes up there. And then again here, we are moving this along. And if there's a part that once we've assessed before feels very tight, again, we can be moving that tissue in different directions. Okay.
Amazing. This is the first time you two saw the videos.
Yes, it's quite sort of uneasy to see.
It's too confronting.
Seeing your own abdominal skin there. Yes.
Yeah.
I know, but thank you so much for doing this, because I think it's really important for people to get a feel of how to actually do it. And it's better to show it in a video rather than illustrations or talking about it and so on.
I just wanted to really point out the time scale, because as we said, we start ideally, we see women in pregnancy, we prepare them for that initial stage post C-section, first few days, then we see them at 6 weeks. But of course, we do see those ones who have been months and months, or sometimes even years after a C-section, and we still see some really interesting results when we work. And often with those ones, we can then, if they're not too hypersensitive, we can assess where the tightness is, where the issues are, but we can sometimes work even deeper and actually see some great changes, even with some vague, deep, low back pain or bladder issues and concerns that we see that are sometimes related to that adhesion of the scar onto the bladder and just tightening the whole lumbopelvic sacral area.
Yeah, and I think I want to mention something else as well, because it's not just about the C-section scar. It is, I think there's a lot of misinformation out there, or a lot of people going through a cesarean section thinking they don't need pelvic floor work because they haven't had a vaginal delivery. But it is just as important. Can you talk a little bit about that and how the pelvic floor is still affected even if you've had a surgical birth?
So it's just being pregnant. So just the weight of the baby on the pelvic floor for the 40 weeks creates often a weakness in the pelvic floor. Plus, we've got all those huge hormone changes, which we know about. So what the research is showing is that maybe in the short term, if you've only had cesareans, maybe you're going to have less issues with incontinental prolapse. But by the time we get to menopause, especially when it comes to incontinence, so leaking of urine, those numbers seem to even out regardless of what type of delivery that you have had. There is a little bit more protection from prolapse aside if you've had cesareans. But we all know women who have only had cesareans, and during pregnancy, they are still leaking urine with coughing, or sneezing, or jumping. And so that is an indication that there is already some pelvic floor muscle dysfunction at that point.
And we also do understand that there's a very intimate connection between the lower abdominal control and strength together with the pelvic floor. So when that whole area of the lower abdominal where the operation gets done gets disrupted, in so many different ways by having an operation there, that ability to engage the lower deep abdominals gets often puts extra demands on the pelvic floor. And so you see women who get very overactive in the upper abdominals, and that lower abdominal just is not really moving much, which then creates a bit more pressure also on top of the pelvic floor. Yeah.
Mm-hmm. And I have one more question regarding this excellent C-section booklet that you've made, because I really think it's such a good idea and such a good resource for people. You are mentioning exercises there, which are core exercises and mobilization exercises and so on. So what is the timeline on that for C-section clients? When can they start doing these?
So the ones in the booklet, they can start doing for sure the breathing exercises, as well as just the deep abdominal connection, the pelvic floor, from as early as they feel comfortable. So as long as it's not causing any pain, then they can start even from the first week to do some of those easier exercises. By 6 weeks, when we assess them, between 6 to 8 weeks, whenever they're ready to come, then we can take them that further step and just test their strength. If there's no pain, we can progress the exercises in terms of demand. But like with vaginal births, we still ask women to give it 12 weeks before they go back to high intensity exercises that involve jumping, skipping, hopping, running. Of course, there is definitely a lot of nuances with that. So we will be assessing each person. If somebody's desperate to go back and we've assessed that they're safe to do so, then we may assist them in getting back to that. Yeah.
Amazing.
I don't have anything.
Great. Anything else you wanted to add?
No, just going back to the scar, I think what we sometimes see is that women who have an emergency cesarean, so they weren't expecting it, we often see there's a slight increased sensitivity in their scar. And it's not because anything was done different during the surgery. It's often just an emotional thing, attachment, or some difficulty sort of dealing with the scar. So they don't touch it at all. They ignore it. And actually not touching the scar causes sensitivity. So I talk to my patients about loving their scar, touching it from as early as possible without causing any pain. That's really important.
Amazing. Thank you for that. Okay, I'll move on and I'll say a little bit about how doulas support C-section clients. And then we'll have some questions at the end. So if everybody can please stay on. I just wanted to say a little bit more about me. I'm the owner and founder of Bumpwise. We offer antenatal classes. We offer birth doula services. But more importantly, we're a peer-to-peer support community of over 2,000 parents here in Singapore. And I want to bust a few myths, and one of them is that doulas only support natural birth, whatever natural may mean to you. But we actually do support C-section, Caesarean births as well. In fact, just this past year, I think 10%, a little bit over 10% even, were scheduled Caesarean sections for whatever reason, a breech baby, twin deliveries, and so on. There is no right way to birth, right? So we want to make very clear that we support anything the client chooses. We may want them to make informed choices, and we want to make sure that they make the decisions that work for them and for their family. And then another myth is actually that we just support the birth, but we're really there for the whole duration of your pregnancy as well as the postpartum period. So specifically, how we support C-section clients is we make them aware of all their choices. And this goes down to even choosing your hospital, because hospital protocols differ. So in one hospital, you might be able to directly latch your baby in the recovery room, whereas in other hospitals, you have a 1 to 2 hour delay before you first get to latch the baby on and start the breastfeeding journey. So this is one thing, for example, but also we will refer to other professionals like, for example, Dr. Maithili and other IBCLCs to do colostrum harvesting to prepare the body in that way. And then explaining in detail what happens during a surgery, because the doctors often don't do that, is my experience. So literally talking about what the room setup will be, the kinds of what will happen before the actual surgery, when the husband is able to go in, what to expect in recovery. We help the husband have skin to skin with the baby in the postnatal room, rather the baby having to go to the nursery and being isolated for the first 1 to 2 hours. So that's an important thing as well. We write C-section specific birth plans. So a lot of people are not aware that they have options when they go for a surgical birth, but they actually do. We can talk about things like the microbiome and how vaginal seeding could potentially be aiding in that journey and for, making their immune system really strong, which Caesarean section babies often lose out on because they're not born via the vagina. We can talk about the milking of the cord because delayed cord clamping is not possible. So these are all things that we do with C-section patients before they go in for the surgery. And then postpartum, really, we do what we do with every client. We check in with them every single day. We make sure that everything is on track. If they choose to breastfeed, we're basically making sure that we obviously help initially with everything breastfeeding and just knowing what to expect and helping with first latch and so on. But then just keeping track of, is this baby suckling well? Is the mom okay? Is everything going well? Or do we need to bring a lactation consultant on board, for example? As well as connecting them, obviously, with a lot of professionals like physios, or spotting red flags, like with a C-section scar and saying, hey, that doesn't look quite right. I think it's a good idea to call the clinic and see if you can see your care provider sooner rather than later. So in a nutshell, I wanted to keep this very brief, but we do support C-section clients, and I think they need the support just as much as a mom going through a vaginal birth. So do visit Doulas of Singapore and the doula directory to see who can support you for your upcoming birth as well, and be your Sherpa on this journey, kind of thing. Okay, thank you so much. This was all. I just want to see if we have some questions. Hi, Jack. Hi, Dr. Tey.
Hi.
Hi, everyone.
And if possible, for all the speaker and participants, if you also feel comfortable, I think in an Asia setting, particularly Singapore, we like good photo. So we can take a good photo accordingly. And at the moment, I look at the chat. I think we answer most of the question already or comment already. But of course, feel free to share us your questions, and we can pass to the right expert accordingly. But I think it'll be good to have some. It seems friends meeting old friends here, so that's good. And I think let's wait for 10 more seconds. I think some colleague busy making their hair and or everything maybe.
Putting some clothes on. Yeah.
Yeah. But don't worry, I'm my another skill is Photoshop. I can do lipstick for you, no problem, like that. But for the interest of time, I will take some photo now. Okay, when we are ready. Okay, so because I do the screenshot only, so maybe you need to keep your face not moving like few seconds. It's not like one second thing. It's a few second thing. Okay. So I say 1, 2, 3, but you freeze like few seconds. Okay. Okay. Good. I also have Diana. Okay. So I say 1, 2, 3, and then you freeze. Okay. 1, 2, 3. Okay. You work, and the most important thing is everybody's eye is opening at that time. So that's mission impossible. But Joanna, firstly, I want to, on behalf of the whole team, to thank you organizing this, because you bring all the great experts in the whole ecosystem. Me as a gentleman, we don't know. There's so many experts there in the field, from different sector. You need to the mother can get help from. So I really appreciate and really thank you for your help in connecting all these people. And I think also mentioned in the meeting chat that I think it could be an idea. We can discuss with the speaker, and if the participant interest, let us know that maybe why don't we all, different experts can work together and form some sort of a group, alliance or community, so that we can raise the awareness of all different experts. Because sometimes the mom didn't know, oh, there's an expert for me on nutrition, on physiotherapy, on manage, on scar, or they just know maybe only 1 or 2 kinds of thing or help only. So maybe that's something as a next step we can discuss. a joint group or joint education leaflet and more education material webinar like today as well. So that may be something next step, Johanna.
That sounds like a great idea, big challenge, but thank you so much for inviting us. Thank you for joining us, practitioners and clients alike. Really happy to have had you here. I know it's not easy to take an hour, 2 hours actually, out of your busy days, but I think we all learned a lot, and I'm really grateful we pulled this together. So thank you to everybody who presented. Thank you for everybody who attended. And if you have any questions, please reach out to any of us, and we're happy to facilitate some connections as well.